My name is Maddie King. I'm 20 years old and I was recently diagnosed with stage 4 Hodgkin's lymphoma, which is a cancer of the lymphatic system. And I got that diagnosis when I was 19 at the end of 2019. I love like all things fitness. I think that's kind of like my little thing. So I'm kind of training to be a Pilates instructor at the moment with KX Pilates, and fitness and health is just a really safe space for me. Outside of that, I am a business student. I'm studying a Bachelor of Commerce at Sydney University, and I love my cats.
Oh, and will they make an appearance?
I can make that happen. I can bring a cat here.
Excellent. That's what I want to see. I'm a big animal person. So kind of take us through like the diagnosis, like how it happened, because, you know, being 19, it's probably the last thing that you would expect. It wouldn't have been on your radar. What was it?
It was not on my radar at all. And because I was so young, I think that led to my diagnosis being delayed for a lot longer, because no one was having alarm bells going off when I came in with like a lump in my neck and feeling short of breath and them going, oh, cancer. Like it just wasn't what jumped to their head. My diagnosis was a bit interesting. It took 4 months from the day that I first walked into the doctors until I finally got diagnosed. So I felt a lump in my neck. It was just about like here, above my collarbone. And I went into the doctors and they actually did everything right. So I had bloods done, CT, X-ray, and ultrasound. And they were like, oh, you've got some inflamed lymph nodes and there's like something going on in your lung, which is what showed up on the X-ray. They took a needle biopsy, which is where they take a tiny little sample of the lump and they tested those cells. But because the sample was so small, it came back negative for cancer. And I also had a blood test come back that said I had something called mycoplasma pneumonia. So they said I had pneumonia. And because I wasn't really showing any other symptoms aside from this lump and like a little bit of a cough, it wasn't until with hindsight I realized that I had been getting night sweats as well, which are another symptom. But they just thought, you're so young, you're so healthy, this cough is probably from pneumonia, like we'll give you some antibiotics, it should clear up. And during that time, I was planning to go overseas and start a student exchange in Los Angeles at the University of Southern California. So it was in the 1 or 2 months leading up to that. And so we were kind of trying to hurry everything along and say that we just need to figure out what this is because I need to leave the country. And they did another second biopsy called a core biopsy where they take a little bit of a bigger sample, but that came back negative for cancer as well. And so they were just like, yeah, like you should be fine, just keep taking these antibiotics. In reality, a third of my lung was covered in tumors. And because I was so fit and healthy and I just thought I had like bad cardio, it was actually masking how bad the problem was. And it wasn't until I went to LA, because I ended up going, that I was coughing up blood, getting really short of breath and feeling really tight in the chest. And they told me to check up with the doctor over there just to see how everything was going. None of my symptoms had eased. And he kind of said to me, like, you have the option to either do like a surgical biopsy here or you need to fly home. So I made the difficult decision after only spending 6 weeks over on that exchange when I should have been there for 6 months. I flew back home to Sydney to have the surgery, get like an entire lymph node cut out and tested. And I ended up getting my final diagnosis that it was stage 4 on the 24th of October. So we're coming up to 1 year from when I was diagnosed soon.
How does that make you feel that it took kind of 4 months and that's the journey that it went on to get the stage 4 diagnosis? Like,
yeah, look, it's difficult for me to say because obviously in hindsight, I feel really frustrated about it. But, you know, looking at everything they did, the biopsies were coming back negative and you can't treat a negative biopsy. And I wish that I had known that to really diagnose Hodgkin's, you do need that entire lymph node cut out because the cell sample is too small with the other 2 types to get a proper diagnosis. And I just wish that, you know, coming in with these symptoms, which I think now was so obvious for lymphoma. I just wish that the doctors were trained a bit better to pick that up so that they knew, okay, even if this biopsy comes back negative, we need to push further for answers. Like my lump was massive. It looked like a prosthetic, like, you know, glued on. And I just look back at that and I just can't believe that they were thinking that it was pneumonia. Like it's just ridiculous to me. But at the end of the day, they go off the tests and the tests were saying that it wasn't anything serious. And so you can't treat someone with chemotherapy if you don't even have a diagnosis of their disease.
What does stage 4 look like? That's pretty intense.
So yeah, the way that they stage it for lymphoma, at least I know it's a little bit different to solid tumors, is if it is above your diaphragm and stays within the lymph nodes, then it's stage 1 or 2. So if you have it in just your neck, it would be stage 1. If you have it in your neck and your chest lymph nodes, it would be stage 2. And then as soon as it goes below the diaphragm, it becomes stage 3. And as soon as it spreads into any other organs, it becomes stage 4. So mine was only in my neck and my lung. They think that it traveled through the lymphatic system to get to my lung. But because the lung is an entire other organ, they just classified me immediately as stage 4.
What's the treatment like?
It was pretty harrowing. I had to have the most aggressive treatment that they could give me up front. It was a combination of 7 different chemo drugs called escalated beer cup. I had to have my eggs frozen beforehand because there's a really high chance that my treatment would leave me infertile. So I had to do IVF a month before I started. And it was a schedule of a 21-day cycle. I would go in for chemo on day 1, 2, 3, and 8. And that was a mix of IV and oral chemo. So they really hit me with everything that they had to get rid of it because it was so advanced. And I had that for 6 cycles, which took me to about 5 months of chemo altogether.
Oh my gosh, Maddie. Like, I just think, you know, I've got a nearly 16-year-old. And just to think that you were going through all that, like, not much older than my child, you know, how hard is it for, you know, a teenager, like essentially a young adult, to advocate for themselves in a health system that for an adult, hold on one sec, I'm going to ask that again. My son has a friend over and all I can hear is them screaming and yahooing, which I'm loving, but it's so distracting. How hard is it for a young adult to navigate, which is already a completely complex and overwhelming healthcare system? You know, you have your parents, but, you know, it's essentially, you know, the amount of emotional strain that would have been on them as well. You know, how hard was that for you?
Yeah, so this is actually quite a twofold kind of response from me. I lost my dad to cancer when I was 16. So this wasn't really our first run on the roundabout, if you will. Like, yeah, we've been on this before. Unfortunately, he had pancreatic cancer and that's very aggressive. It was diagnosed very late. And so he didn't have to go through chemo or anything. But I think once this whole idea of cancer got brought up for me, it just like my thoughts just instantly went to my mom, like, you know, she has to go through that again. And I think it forced me to grow up really quickly because I didn't want her to see me sick. I didn't want her to worry about me. Like, you know, I'm her only daughter. Like, I knew that it would have broken her heart. And I actually didn't let her come to any of my chemo appointments because I didn't want her to see me like that. So my brothers flew in because they're both from overseas, and they flew in and my friends came. And so they were like really my support system throughout all of that. And like my partner as well, he was sitting with me and coming in to all of those appointments. So I really relied on them a lot. But in terms of navigating the whole experience myself, I think your body really just goes into fight or flight. You don't think about what you're doing, and your life just becomes a series of appointments. You live from chemo cycle to chemo cycle. You're defined by your good days and your bad days according to treatment. On the days where you feel better, maybe you try go out have a coffee with some friends. This is pre-pandemic because the last cycle of chemo was during COVID. But yeah, on my good days, I was doing yoga, like I was trying to move a little bit. But on my bad days, I was really low and really sick, and I felt really lonely. And it was hard seeing all of my normal friends move on with their lives and go to the beach and, you know, catch up with each other and go out. And it does make you feel like you have had like some of your innocence stolen from you. I think ignorance is bliss. And while I was exposed to a little bit of that at 16 when we lost dad, I think it just hits a lot closer to home when it's your own life on the line. And being so young and being forced to like think about your mortality that young. You think you're invincible when you're 19 and through your 20s. And I guess it was almost very frustrating for me because my mind just went, sorry, my throat's like stuck.
Get a water.
No, I'm good. Yeah, like it was really frustrating for me as well because in my head, I was like, I've done everything right. I've always eaten really healthy. I have been exercising since I was a young girl. Like I was the picture of health. And it just really made me question why something so sinister was happening to me when I was so young, when I should be in the prime years of my life. And I think that that's very difficult to grapple with and come to terms with even now.
And I think, you know, it's always that mindset of what did I do to get cancer, or what didn't I do, or you know, a really strong message just even from listening to you is you're never too young, fit, healthy for cancer. Like cancer doesn't care about those things.
Exactly.
It can grow in any environment, in any human, and it's I feel, you know, it's so hard to kind of watch such young, healthy people go through what you're going through. I can only imagine what your mother, you know, losing her husband, then having to watch her only girl, like that's just huge.
Yeah.
How is COVID? Like COVID is like that line in the sand, right, for every human being, but for more so for the immunocompromised. Like how has COVID changed Maddie? Everything about your treatment, about how you go, your mental health, you know, how has COVID changed you?
Yeah. So COVID, I think when it was getting really bad in March, it was kind of coming into Australia at the same time that I was finishing chemo. So my last cycle, which was my 6th cycle that happened in early March, was the only one that was really affected by COVID rules. And so I was only allowed one person to come with me for my last cycle. And I intended to have like a big celebration with my friends and get everyone together, which of course I couldn't do. And honestly, I was so tired, I didn't even mind. I was like, you know, I'm going to finish this chemo, I'm going to go to bed. Like I was just exhausted. But I think as it started to get worse and we went into a proper lockdown, that kind of coincided with all of this anxiety from treatment catching up to me. I think I'd been running on autopilot for so long, and suddenly I was like, oh my gosh, I really like I had cancer, like what just, and you know, trying to process all of those emotions in your head at the same time as knowing if I was to go outside, because my immune system is so low, I was neutropenic. So I think I had like less than 1% of white blood cells, however they calculate it. So I had no immune system. And it was a scary thought to think, oh, if I wanted to go outside and go for a walk, if I ran into someone, then it's just that added layer of anxiety on top of everything that you're dealing with. And then I think as restrictions started to ease, it did get a bit better in that I would just put on my mask and go out a little bit more, but I still wasn't comfortable enough to like see my friends and groups of people, especially people I know who weren't taking it as seriously and not being as careful as I was, because of course, you think you're invincible when you're 20 and you're just like, whatever, I'll get COVID. Like, I'll go to the bars, it'll be fine. So it didn't affect my treatment so much, but it definitely like put a downer on the whole period coming out of treatment. And I thought that I would just be able to like reintegrate into life a little bit more and separate myself from all of this isolation that is brought on by the experience of chemotherapy. And it was just kind of upsetting that even as I was a few months out of treatment, I was still staying at home, being quite isolated, having to be super careful, not able to see my friends and not able to do the things that I love to do because it was too dangerous for me.
Yeah, your story, I wish I could say, is rare and unique, but you know, you were at the Humanized Health photo shoot and surrounded by young, healthy, gorgeous human beings that all have their kind of unique experience. What's your message to other people, to other young adults especially? You know, it's more common than young people think.
Yeah.
Just look at the photo shoot and the amount of people that were in the room that were affected. What's your message?
I think the strongest thing that resonated for me is that your body is the only home that you truly have. You know, you can move through life, you can move countries, move houses, but the one thing that you can't move out of is your own body. And I've been there where you think that you can treat it not that well or treat it like crap, essentially, as some people do, and not notice the warning signs that it's giving you when something is off, because you think that you're young and you never jump to anything sinister happening. And not just cancer, there's a million other conditions that affect young people, and my cancer is actually one of the most common cancers in people under the age of 35, and I had barely even heard of it before I was diagnosed myself. So I think just a combination of really like trying to stay in tune with your body. If something is off, don't just settle for that blanket answer that the GP gives you. Take care of it, nurture it, and just pay attention to it and push for answers if you think something's wrong.
What does the future look like, Maddie? Like, do you often, you know, being 19, you know, we're not necessarily planners. We live in the moment. Are you still living in the moment? Do you still have that kind of attitude, or are you looking at the future, and what does it look like?
I have moments of both. I think especially with with lymphoma, they don't say that you're cured until you're 5 years out of treatment. So obviously, especially in the next 2 years when the risk of relapse is the highest, I still kind of am holding back a little bit, because I feel like the further you get out from treatment, if I was to relapse, almost the heavier the fall, like the more that would hurt. Once you get a taste of normal life, you don't want to have that all taken away from you again. So there's definitely a bit of hesitancy in terms of if I wanted to make a big move somewhere or do something really crazy, that I do have to think about being close to the medical system here, because I do still rely on them. I still need to go in for my checkups, and if something was to happen, I would need to be home. But it has also taught me that I do need to live in the moment a little bit more, and you never know what's around the corner. And even if I was to relapse in a month or a year, I wouldn't look back on this time and regret not having fun and not smiling and living my life. In terms of the future, though, there are definitely questions that arise. Like, I'm thinking about if I wanted to have children, and I do want to have children, the discussion that would need to happen with like my partner, if IVF was something that they would feel comfortable to do. Obviously thinking about if I'm going to be able to get pregnant at all, because I don't know if my period's going to come back. I don't know if my fertility is something that's going to heal. Some people do, some people don't. Everyone is just so different. And again, there's just a lot of uncertainty with a cancer diagnosis. And I think it's just about living each day, trying to enjoy it, but also acknowledging that there is that darker side of emotions that you need to deal with, and you need to learn how to cope with your anxiety and all of this uncertainty so that you can live kind of a normal life as best as you can.
I think, you know, I saw on your Instagram that you uploaded these modeling shots of you with your gorgeous, long, luscious locks.
Yeah.
And was that kind of, you know, being young and being 19 and being as gorgeous, you know, you're a model, like losing that hair and feeling not yourself, how hard was that?
It's really interesting. The hair loss affected me much less during treatment than it does now when I actually have a little bit of hair growing through. I think, again, because you are just running on autopilot on adrenaline during treatment, and you understand that all of the chemo and the reason that you lost your hair is to save your life. And I think that that very simple explanation kind of gets you through those months. But now that I'm on the other side of it, and like touch wood, I'm healthy, like I don't have cancer anymore, And to the outside person, I just look like someone who decided to get a pixie cut. Like, looking at me, you wouldn't be able
to. You look so cute. Like, about the like, if I've put on a pixie wig before and it's not pretty.
Yeah.
You make pixie look cute.
But I think almost because I do look healthy, and you kind of start feeling those social pressures again that a young woman feels, where you feel insecure about your body and how you look. And obviously being on social media, and I'm quite active on social media, I love it as a way to connect. I've met so many cancer patients through there, but people comment on your photos, they comment on how you look. People treat you differently as well. Like, pretty privilege is definitely a thing, and if you look more like what is societally acceptable, if you have your long hair and you don't look sick, people treat you differently. And I think coming out on the other side, while I'm so grateful, and like I would lose my hair 10 times over if it meant that I could save my life, it is really difficult looking at myself in the mirror and not recognizing it. I also, in my dreams, I still have long hair. So I think there's a part of my subconscious that still hasn't fully accepted that this is what I look like. And I still kind of get little chills if I take photos with friends and I look back on them and I'm like, oh my gosh, like, you really look so different to how you did before. And there's days where I love it and I rock it, and I'm just like, I can put some fun earrings on, I can wear eyeliner. Like, it's gotten me to come out of my shell a little bit in terms of how I look. But there's plenty of other days where I wish that I could just have that long hair back again and just feel confident and like, feel like myself again a little bit.
Yeah. And I think, the face of illness has changed.
Yeah.
I think, in my mum's generation, it was very much like the walking stick, the absolute no hair for years, the relentless non-stop treatment, the really looking sick. And sometimes when I see people who are, say, on maintenance therapy, you wouldn't even know. And I think that's great, but at the same time, it's really hard because you're actually grappling with an illness that inside is making you not well. Yeah. But the outside world, you put on a little bit of a luminizer, style, your hair, get dressed, people wouldn't know. So I think it's definitely got a positive and a negative, because you kind of take the issues home with you, right? Yeah. Like, I suffer from health anxiety, just more broadly, and it's hard to kind of get out of that mindset, right? Like, once the anxiety starts, you have to really work hard to take control of it back a little bit. How important is the patient voice? You talked about how challenging it was just to even get a diagnosis, but the health system essentially has been very paternalistic for a long time. How important is it to really get the patient voice and the experience of patients embedded in the health system, so that a process for a 19-year-old of getting a diagnosis taking over 4 months doesn't happen again?
Yeah, I mean, I think it's crucial, and I think that it starts at diagnosis, but it continues all the way through treatment. You need to continue to stand up for yourself and advocate for yourself. I've been through what I wish, they knew, and what I knew, and I wish I was more educated as well, so that I could have advocated for myself more in those early days. But even during treatment, the first hospital that I was at was awful. They didn't medicate my nausea properly enough. On the first day of chemo, which is usually the worst because all the drugs are being introduced to your system the first time, they sent me home with like quite a low level nausea pill, and that was it. And they said, go home, like, you should be fine. And I ended up switching hospitals because it was just so dreadful. I took myself off that clinical trial and I said, I don't want to do this anymore. I want to go back to the hospital that I'm comfortable with, because I had switched there to do a clinical trial. And I've spoken to other people who didn't feel empowered enough to make that decision, and they've stayed with doctors with treatment protocols or whatever that they were 100% not comfortable with, and they were just too scared to raise their voice and tell their doctors, like, I need a stronger medication for this. My migraines are super bad, I need to treat it. And I think every patient's experience is so different. And while they know broadly what's going on, they're there to treat your cancer and your cancer only. everything that happens outside of that, you need to let them know, and they need to actually be empathetic towards you. And like, especially with young people, we're dealing with so much on top of just the cancer in terms of our mental health and our social circles, that they really need to listen to you. And it's a combination of them being empathetic, you feeling empowered enough to use your voice so that you can make the best out of a shitty experience and not make it any worse than it needs to be.
Oh my gosh, Maddie, like, it's so important. Like, I see shared decision making as not an optional extra, it's a basic human right.
Mm.
And that if we collectively educate and empower and advocate for change within a system, but also, if you share your story with 100 people, you never know that someone could be in the exact same position as you, and their outcome may be just that much shorter, and the person again, they know exactly what they're going in and asking for.
Yeah.
And I think, especially for young adults, it's just absolutely crucial. Thank you so much for your time.
All good. It was lovely to chat.